Hello, everybody. Welcome to Heart and Five by Bia for You, for Them. These are monthly podcasts of 5 minutes where you hear from experts from the community, our physician experts, talking about a health condition every month, brought directly to your doorstep. This month, we're going to be talking about COVID-19, and our physician expert is Dr. Rashmi Rajeshwar. Dr. Rajeshwar is internal medicine hospitalist physician at Corewell Health, Troy and Royal Oak. She serves as faculty at Oakland University William Beaumont School of Medicine and also serves in the Infection Control Committee in Corewell Health East Troy Beaumont Hospital. She was a physician advisor for utilization review for Corewell Health East Hospitals. Dr. Rajeshwar has also contributed to the section on COVID-19 and women's health in our very own book, Bia, She is the Force. Dr. Rajeshwar, what an honor to have you here today to tell us about the research. What are the recent updates, the developments about COVID?
Thank you so much, Dr. Sareen. It is such a privilege to be able to do this for the Women's Heart Health Program with you. With regards to COVID-19, we're now at a point where we aren't seeing the same level of disease. And that's in part due to population-level immunity from both vaccines and infections, as well as effective treatments and vaccines that are now available.
That is so right, Dr. Rajeshwar. We cannot reinstate the importance of it. Rashmi, we are seeing a lot of these patients who come to us weeks and months after COVID infection, and they have what we call long COVID or long COVID-19 condition, chronic COVID-19 condition, or post-acute sequelae of COVID-19, or long COVID, long haul COVID. What are the risk factors? What are the presentations? What is must knows about long COVID?
So the risk factors include women over 20 years. That's basically most adult women. Other risk factors, which we already know, are higher BMI, older age, pre-existing lung disease, ICU stay with COVID-19. Long COVID is a wide range of new, returning, or ongoing health problems that people experience after being infected with COVID-19. It is usually a cluster of physical, psychological, or cognitive symptoms that significantly affects the quality of life. It appears about 4 weeks to 3 months after COVID-19 infection. Physical symptoms include fatigue, difficulty breathing, chest pain, dizziness, chest discomfort, and cough. Psychological or neurocognitive symptoms are impaired memory, poor concentration, anxiety, or depression. It is interesting to note the impact of COVID-19 variants on long COVID. We now know that the prevalence of persistent symptoms have decreased with each successive COVID-19 wave. Symptoms could vary depending on the variant you were infected with, but vaccination may have also impacted these findings. So it is hard to say, is it because of the new variant or because of vaccination? Have long COVID symptoms become less severe overall? Again, prevention and early treatment of COVID-19 in the high risk is most definitely one of the strategies which still remains for long COVID. Vaccination does decrease the risk of long COVID. There is significant variability in long COVID clinical phenotype and underlying mechanisms. So these drive how potential therapies are targeted for treatment or reduction of symptoms. Setting up with a healthcare provider and discussing your symptoms is the first step to diagnosis and management.
Thanks, Rashmi. What a great summary. What I understand loud and clear, what's really important is that if you have severe infection the first time, then the chances of developing long COVID are more. So that's why immunity is the key and vaccination is the key. Any updates about vaccination? What should we know?
Absolutely. The biggest issue with COVID-19 vaccine was the question of myocarditis in the early days. We now know that the overall absolute risk of myocarditis for everybody is low. Especially women are definitely less likely to be affected with vaccine-associated myocarditis. So would vaccinate according to the CDC guidelines at this time.
Outstanding. So vaccination continues to be safe. the risk of developing complications, whether it's heart-related or other organ-related, are much more with the real COVID infection compared to the vaccine itself. So great point, Dr. Rajeshwar. Before we close the discussion, what are some of the tips you want to give our listeners about COVID-19, some take-home points?
Absolutely. So there are three good points to discuss or touch upon. COVID-19 has been associated to increase the risk of venous thromboembolism or blood clots. So it is important to be vigilant with regards to symptoms of leg swelling and pain, sudden onset of chest pain or pressure, sudden onset difficulty breathing, and to seek appropriate medical attention immediately. Pregnancy also does increase the risk of blood clots. So this is something to keep in mind with regards to COVID-19. Second point is COVID-19 has been associated with increased cardiovascular risk. This includes abnormal heart rhythms, heart muscle inflammation, myocardial infarction, strokes, and heart failure. I would recommend keeping up with preventive strategies, especially if you have a cardiovascular history, including taking your medications regularly, adhering to healthy dietary and lifestyle modifications, keeping your diabetes, blood pressure, and cholesterols in check, as well as quitting smoking. All this can overall significantly help decrease the risk. Also, it is important to have a heightened sense of screening for us physicians, and I guess maybe even preventive management for this population. With regards to acute COVID-19 treatments, Paxlovid is the number one antiviral treatment option for patients with mild to moderate COVID-19 at high risk for progression to severe COVID-19. This should be initiated within 5 days of symptom onset. Your healthcare provider will review your medications for possible interactions and may adjust your regular medication dosages or provide alternatives when you are taking Paxlovid. So these are the three take-home points.
Awesome, Rashmi. So get vaccinated. Make sure you do aggressive preventive strategies. It's both on the physicians and, of course, the patients as well, our community. We have to be very vigilant about being preventive because the less risk factors you have, the more likelihood of developing complications. Well, thank you, Rashmi. What a great session. Again, this is Heart to Heart in 5 podcast by Bia for You for Them. To read more details about COVID, please look at beayourself.com, where the book is available, Bia for You for Them. She's the force. Please stay tuned for a monthly 5-minute podcast, specifically selected health conditions. If you have health conditions that you would like highlighted, please send your topics to beayourselfcontact@gmail.com. Until next month, wishing you all health and prosperity. Thank you.
Thank you.